aging populations bring one of healthcare's biggest challenges: keeping people safe, healthy, and independent as they grow older.
Switzerland and Singapore are facing many similar health problems that reduce independence, like falling and breaking a hip, having a stroke, or suffering from mental health problems like depression or cognitive problems like dementia.
Falls are a leading cause of injury among older adults. A single fall can lead to fractures, loss of mobility, and long-term decline in quality of life.
Traditional fall risk assessment in clinics can take hours and are typically geared towards older adults who have already fallen before.
At the Future Health Technologies program, we're working on fall prevention using sensors. We have developed an AI-based tool for early detection of fall risk.
Our tool is more proactive in nature, focuses on identifying fallers before they fall. Building on data from over 4,000 participants, we predict fall risk in just 15 minutes.
Older adults wear movement sensors like those in smartwatch and walk for 6 minutes. From this, we predict the likelihood of older adults falling over the next 12 months based on their walking speed, rhythm, and step length.
This makes large-scale community screening affordable and practical. By spotting risk earlier, we can prevent falls before they happen, reducing hospital visits, cutting healthcare costs, and helping older adults stay active and independent.
Beyond wearables, we are testing new sensor technologies such as pressure mats and infrared sensors to enable fall risk screening everywhere, at home, in communities, and in care facilities.
With our partner Duke-NUS and rich cohort studies, we are building Safe Tech, a digital intervention program that keeps high-risk individuals active and independent.
This project was particularly important to Singapore because we want to increase awareness of falls. We also want to prevent falls, and then when falls and fractures do happen, we want people to understand that rehabilitation works and that there are ways that we can get people back to relatively normal or as close to normal functioning as we can. But the very first step is to identify fallers and then to try and prevent the falls, because prevention is always better than cure.
This was a perfect hand-in-glove relationship that allowed us to use their technology to identify people who are at a sufficiently high risk to benefit from this really intensive program that focuses on strength, balance, gait, flexibility, and endurance. And now for Singapore, we have an opportunity to really take an innovation and bring it into the community for the benefit of Singaporeans at large and to reduce the number of people who fall and fracture. Fracture is one of the most serious trauma events that occur to people in Singapore, and we're going to reduce that together.
Our projects don't stay theoretical. They're tested in real healthcare settings, producing high-quality evidence that Switzerland and the world can trust. The Singapore-ETH Centre is ETH's research hub in Asia. It draws upon the scientific research engine of the ETH in Zurich that plugs into the healthcare and innovation ecosystem of Singapore. The diversity of Singapore's population also makes our models more robust before we adapt them back home.
Falls are preventable. With science and collaboration, we can stop injuries before they happen.